Every year, thousands of NEET PG aspirants do one particular mistake. You know what? They choose a branch which has been suggested or told to them by one of their friends or their mentors. And later down the line, they regret, why did I take this branch? Before you start filling your choices, I would just like you to stop for a minute, have a look at this video. Probably this is going to help you out to make your choices perfectly well. Because in next few minutes, I would be explaining you something which no toppers or rather no brochure will explain you. The actual difference between MD/MS and DNB. Which branch will actually match your rank, goal and also your budget. Let's start with the question. The first question which comes, जो सबके दिमाग में रहता है कि मैं MD भरूं, MS भरूं या DNB भरूं. And what is the difference between DNB and MD/MS? जहाँ तक experience की बात है, hands-on की बात है, MD/MS has got a better experience than the DNB students. जितनी procedural branch है जैसे gynae है, surgery है, non-procedural branch जैसे कि radiology हो गया, pediatrics हो गया, dermatology हो गया, for these branch DNB works wonderful. When you talk of academics, the MD program it's you have your rounds, you have seminars, you have teaching staff, but whereas in DNB it depends on the workload of the hospital and the flexibility you get to work. When you talk of workloads, MD students have a hell lot of workload depending on night shifts and overload of work. But whereas compared to DNB, it's much lighter since they are fewer in number and the number of patients are also less. When you talk of thesis, for MD program, the theses are more, but it is easier because the number of patients are more over there. But whereas in DNB, it's a structural program, but which was supposed to be very tough in the early days. Now, there is a very good pass rate of DNB students also. MD students, depending on central colleges or state colleges, it varies. It's a huge number. It's around 70,000 rupees or 80,000 rupees per month. But whereas DNB students, depending on the city size, it is around 50 to 60,000 rupees per month. Special tip from our side to all the students who are going to fill up DNB as a preference. Number one, you should just have a look at the workload in the hospital, the faculty approach of the hospital, and the departmental strength of the hospital, which is very, very important. That one call to a senior or to a mentor or a consultant can really make a change in your life for lifetime. We try to guide you how to choose a branch. Generally what happens, you should not choose a branch according to the rank. Rather, you should select the branch according to the reality. Now, as you have come to know about the difference between the DNB and the MD programs, we come down, how would you select the branches for your preference form? Now, let's divide the branches into three parts. One is clinical, non-clinical and paraclinical. Especially for non-clinical branches, they are supposed to be opted by the doctors who can settle down in tier 2 cities or tier 3 cities. They can have biochemistry, anatomy, physiology, biochemistry, where they can teach in different colleges and have a lovely life. Ranking based on opportunity. Pharmacology, a huge scope in pharmaceuticals and MNCs. Physiology, a great scope in research and academic careers. Biochemistry is a branch which is research focused and molecular labs. When you talk of paraclinical branches, those are pathology, then microbiology and PSF. Talking of pathology, it is very much high in demand and it's good for research purpose. Pathology, it's high in demand and excellent diagnostics. Microbiology, it's growing fast and it's new in diagnostic technology. ESM, a branch which is often underestimated, but by doing this branch, you can teach, work and join with WHO. Our suggestion to the doctors taking these branches is they can get a stability, they can get academic recognition and free from that corporate rush. Now let's decode what the most of you are curious about to know. Those are the clinical branches. Anesthesia, a chill branch, work-life balance, and a good income pay also. General medicine, a deep-rooted branch which has a lot of studies over there, but a stability career. But this is not an end branch. You will have to go for super specialization after that. Pediatrics, it's highly awarded and emotionally satisfying, but with a limited earning. Unless you do a course in neonatology. Honestly, this is a great course if you really love kids and a family orientation. When you talk of dermatology, it's a highly paid branch, a very good exposure and work-life balance and flexible timing also. But the worst part is it has got a very, very heavy competition in the market. This branch is perfect for doctors with a business interest and aesthetics. Radiology, top choice for toppers. It's very highly analytical branch. You have to have that kind of mindset. And what is very well said about radiologists, it's a white collar job. General surgery. This branch has to be chosen by the only doctors who have a passion for surgery. It's highly rewarding, but it takes lots and lot of time and it has a very big rising curve. Oncology, it's a branch which is fastest growing, and it is good for doctors who are interested in patients relationships and research work. Orthopedic, it's highly in demand, and the best part, it's an end branch. It's more of a male dominated. It's a wonderful branch. It's a very innovative branch. If you really like the video and you find it as informative, so I would just like you to like, share to your friends as well. And for further details, if you want to know further about more about counseling and choices of branch, you just check the descriptions and you can get in touch with us, so that we will be having one-to-one session with you to explain each and everything in detail.